A lot of women get told that they have adenomyosis and they really do not know or understand what that is. You've heard of endometriosis, you've heard of fibroids, you've heard of PCOS, but not many women would have heard about adenomyosis. Although it's out there and many women can have endometriosis as well as having adenomyosis also. You'd be forgiven for describing adenomyosis to be the opposite of endometriosis. Whereas endometriosis, the endometrial lining of the uterus, is found outside of the uterus, with adenomyosis, the same endometrium that is a problem in endometriosis is actually found embedded into the myometrium, which is the muscle bulk of the uterus. So the endometrium, which is where the baby will lie as it grows in the womb as a fetus, actually starts to grow within the myometrium. The symptoms include painful period, chronic pelvic pain, heavy menstrual bleeding, as well as fertility challenges. Adenomyosis affects your fertility in several ways. The first way is by causing uterine inflammation. Chronic inflammation creates a hostile environment, and as a result, implantation will not occur in this type of environment. The second way is by disrupting the uterine structure. Again, this will affect implantation. A very thickened uterine wall as a result of infiltration of the endometrium will cause a distortion in the endometrial lining, and as a result, implantation of the embryo cannot happen. Poor blood flow. So you can imagine if the uterus is enlarged because of all the adenomyosis within uterine wall, the uterus will not be able to receive an adequate blood supply. And this is detrimental to the health of the endometrium. The endometrium, which is where implantation will occur, has to have a good, solid, and a constant flow of nutrient-rich blood. So if the endometrial lining is not receiving this oxygenated, nutrient-rich blood, again, implantation will be affected and it will fail. Besides affecting implantation, there is a hormonal imbalance that occurs in adenomyosis.